Welcome to the PD Pet Care Vlogs. I'm Dr Cath Watson. Dental problems in cats and dogs are really, really common. So should you consider getting dental pet insurance? Absolutely, I would say I would strongly recommend you get pet insurance anyway, and then I would even more strongly suggest that you look at cover for dental disease because it is so common. Just to note at this point though that any dental insurance, any pet dental insurance won't usually cover cosmetic procedures, routine checks, cleaning of teeth for routine dental care and dental diets. However, different insurers do handle dental care differently, so it's really important to understand how your preferred insurer covers dental insurance or dental care. So in some cases it may be part of the policy. So for the deluxe package from PD Insurance, dental insurance is covered. It can also be an optional add-in in some cases, and some insurers may not actually cover dental disease at all. So what are some of the common conditions that dental pet insurance may cover? Things like gingivitis, inflammation of the gums, periodontitis, so that's a more severe infection of the gums that's actually starting to eat away at the connections between the tooth and the bone, the stuff holding the teeth into the bone and the face. It can be abscesses and infections, broken teeth, oral tumours, so cancers in the mouth, retained deciduous teeth, so this is the milk teeth that they're born with. They should shed those as the adult teeth come through, but sometimes those teeth end up retained, particularly the canines, and they will need to be removed so they don't end up causing disease. And then in cats, there's two specific conditions that we see in cats. One is resorptive lesions in the teeth. So these are cavities that end up effectively destroying the teeth and they break off, leaving roots behind. And ulcerative stomatitis, so really severe inflammation in the mouth, bright red, they often struggle to eat. So pet dental insurance, those are the sort of conditions that you want to make sure are covered. But obviously also the onus is on you to make sure that you're undertaking preventative care as much as possible to reduce dental disease developing, regularly checking your cat or your dog's mouth, getting them used to you being able to lift their lips, open their mouths, have a look inside. If you can't do that, book in with your vet and get them regularly checked, because it is much easier to pick up problems early and deal with them at that point than waiting until potentially there's a mouth of rotten teeth there. Cleaning teeth at home, if you can't open their mouth, that's probably not going to go so well, but if you can, then looking at investing in a toothbrush and some pet-safe toothpaste. Looking at dental diets can be a good way of helping to try and manage some degree of dental disease as well. Chews, water additives, there's lots of options out there. Please go and talk to your vet about what the options are. You may need to book in to get their teeth cleaned in the veterinary clinic. That will require an anaesthetic and is usually very safe and very good as a preventative way to stop tooth problems developing. But also things like avoiding really hard objects. So if you've got a dog that particularly likes chewing stones, trying to minimise their access to stones and giving them softer objects to chew on, like a rope toy instead, because those really hard objects can end up fracturing teeth, and then obviously not throwing really hard objects for them too that they might get hit by. And then understanding your individual pet's risks. So are they a cat, in which case they're definitely at risk of resorptive lesions because about 80% of cats develop them. Have you got a dog who is much more likely to have retained baby teeth as well? Understanding those risks. But the bottom line is dental disease is really, really common. I would strongly suggest you consider, if it's not already included in your pet insurance policy, then looking for a way you can get some cover for dental disease as well.